Welcome to the Health Sciences Library Ovid Medline tutorial. This tutorial will explore the keys to successful searching within the Ovid suite of health databases, specifically Medline. By the end of this tutorial, you will be able to transform your research question into searchable concepts, build a comprehensive Medline search strategy utilizing Medline-specific subject headings, keywords, and limiters, review and refine a Medline search strategy to improve results, access full-text journal articles relevant to your research question, access citation statements for journal articles in AMA, APA, and MLA, save and export your results for further analysis, save your Medline search strategy. Let's get started. You can navigate to the Ovid databases from the McMaster Library's website at library.mcmaster.ca. Scroll to the bottom of the homepage to find Health Sciences Library. Clicking this link will redirect you to the Health Sciences Library's website at hsl.mcmaster.ca. You will find Ovid right on the homepage. If you are off campus, clicking on the Ovid link may prompt you to log in using your Mac ID and password. Ovid is a host to a number of different databases. Because each resource utilizes different indexing vocabulary and search features, it's best to only search one database at a time. Otherwise, we may risk compromising the quality of our search. For more information on the coverage of each resource, click the information icon. There are two different Medline databases to choose from. For the most comprehensive Medline search, select Ovid Medline EPUB ahead of print, in process, and other non-index citations, which provides access to articles published from 1996 to present. However, note the difference in dates of coverage for both Medline databases. Depending on your research question, you may select Ovid Medline All to search for articles published all the way back to 1946. This will redirect you to the Medline search screen. When searching databases, we take a concept-by-concept approach. The easiest way to identify key concepts is to develop an effective research question. Let's imagine we're conducting a literature review on the topic of physical exercise and mental health amongst older adults. Our research question may look something like this. In adults over the age of 65, is regular physical exercise effective at reducing psychological stress? In a well-stated and specific research question, key concepts should be easy to identify. Key concepts are the distinct topics that need to be present for a result to be relevant. Take a minute to look at your research question. What are the key concepts? Can you make them more specific? In this research question, we're interested in adults aged 65 plus, physical exercise, and stress reduction. If an article contains all three of these concepts, we'll likely want to take a closer look. Now that we've identified our key concepts, we're ready to turn those concepts into search terms and start searching. Unlike Google, Ovid databases work best if we search one term at a time and then combine them. It's also important to note that there are two types of search terms we can use within Medline to capture each of our concepts: subject headings and keywords. Subject headings, often referred to as mesh terms, are database-specific subject tags assigned to journal articles. They are a fast and efficient way of gathering a large set of articles related to each concept. Let's try to find a subject heading for our first concept, which is our population, adults over the age of 65. Enter the concept and click Search. The suggested subject headings appear as blue hyperlinks. They're sorted by relevance to our term or phrase. Here's one called Aged. Is this relevant? Clicking on the I will take you to the subject heading Scope Note. This provides us with a brief definition, related subject headings, and terms that the subject heading is used for. As we can see under Scope, the subject heading Aged is used for a person 65 years of age or older. Great, This is relevant for our population. The scope note also tells us that for a person older than 79 years, aged 80 and over is available. We'll keep that in mind. Medline gives you a couple of options for customizing your subject heading search. The focus checkbox will narrow results to articles in which the subject heading aged has been identified as the primary topic. Because our question deals with multiple equally weighted concepts, we'll leave the focus option unchecked. Located beside focus is the explode checkbox. This option could be more helpful. Many subject headings can be broken down into more specific terms. The explode function allows us to capture all of these terms in a single search. Clicking on the subject heading aged takes us to the subject heading index, where the database's subject headings are arranged in a hierarchy of broader and narrower terms. Scroll down to find our subject heading highlighted in blue. We could select aged as our subject heading, however, there are narrower terms that can be further expanded. Be sure to view the scope note for each term to determine if it's relevant to your research question. Since our question is interested in all adults above the age of 65, we'll likely want to include these narrower subject headings and their result sets. So we'll select the Explode checkbox for aged and click Continue. This brings us to a list of subheadings that will narrow your search to articles covering specific aspects related to our subject heading aged. Subheadings can be used to restrict the focus of your search. This can be helpful for quickly locating a handful of specific results, but they're typically not appropriate for comprehensive searches. Click Continue to include all subheadings in the search. The subject heading aged has been added to our search history. The EXP next to the term tells us that the subject heading has been exploded, meaning aged and its narrower subject headings have been included in our search. The number of results is also displayed. Try this with your first concept. Let's scroll down and look at our results. Click on Complete Reference to view the database record for this article. The record contains important information about the article, such as title, authors, abstract, and more. Our subject heading search only searches the mesh field. This result came back because the subject heading aged has been assigned to this article. Recall that subject headings are just one type of search terms we can use in Medline. Let's broaden our first concept by supplementing this subject heading with some keywords. Keywords are the second type of search term we use to search a database. Unlike when we search by subject heading, keywords appear anywhere in the database record. Keep in mind, we are not searching the full text of the article. Rather, we're searching for keywords in fields like the article's title, abstract, and author-supplied keywords. Just like how you and I may use different words or phrases to describe the same thing, authors also differ in the keywords and phrases they use in their articles. So when developing keywords, we want to think of all the words or phrases that could represent our concept of interest. For our first concept of adults over the age of 65, some of the keywords we could try include elderly, seniors, or geriatric. Unlike subject headings, keywords are not standardized, which means we need to consider all the variants of each term. For example, if we're interested in articles that contain the keyword senior, we're probably interested in the plural seniors. We should also consider alternate word endings. For example, instead of elderly, some authors may use the words elder or elders. If we put an asterisk after the root of our keyword elder, we're telling the database that the word can be completed in any way. This is known as truncation, and it allows us to search for multiple forms of the keyword without typing every single variation. Adding .mp. to the end of your search tells the database that these keywords can be found anywhere in the database record of an article. When we select Search, a new line is added to the search history, and the results are displayed. These are articles in which some form of the root word elder appears in the database record. Follow this same process for all the keywords related to your first concept. At this point, we have now searched for the appropriate subject headings and keywords for our first concept. Each of these lines is separate from one another, but we want to combine them. We want to tell the database that at least one of these terms needs to show up in our results. To do this, we can use the Combine with OR feature. OR is used to combine terms within a concept, and it helps to broaden our search. Click on the boxes beside the terms and select Combine with OR. Alternatively, you can use the keyboard shortcut to combine the terms by typing OR/1-5 and selecting Search. Now we can start searching for our second concept. Type exercise into the search box and click Search. Again, we're shown potential subject headings for our concept sorted by relevance. Let's explore exercise in the subject heading index. There appears to be quite a few specific types of exercise. I'm going to keep that in mind in case I need to refine my search later on. For the time being, we'll use the Explode button to include our subject heading exercise, as well as the narrower subject headings underneath. Select the Explode checkbox and click Continue. Include all subheadings to ensure your search is inclusive, and click Continue. The subject heading has been added as a new line in our search history, and the results are shown. We can add keywords to supplement our exercise subject heading. These keywords could include broad synonyms like physical activity, as well as more specific types of exercise like yoga. We'll enter all of our keywords followed by .mp. to complete our concept of exercise. Again, we can combine all of our exercise subject headings and keywords using the OR keyboard shortcut. We'll now complete the same process for our final concept of stress. We have now combined search lines for each of our three concepts. We want to see where these three concepts overlap. So select the search lines representing each concept and combine them using AND. We're given a new results set containing articles that include each of our three concepts. Here, we can see the total number of results yielded by our search. That's a lot of results. Scroll down to take a look at the results. If they aren't as relevant as you were expecting them to be, you may want to revise your search strategy. Remember, searching is an iterative process, and we often have to revise our search strategy several times, either broadening our search concepts or narrowing them. One way we could refine our results is by focusing on a specific type of exercise. After reviewing the initial list of results, I might decide to look more closely at walking, for example, and whether it can reduce psychological stress in adults over the age of 65. Let's return to our search box and search walking. We'll recombine our concepts using AND, replacing our broad exercise concept with our specific walking concept. Here is the new number of results. This should be a more focused result set. In addition to being more specific in our concepts, we can narrow down our results further based on factors like language or publication date, using the database limits. This will help us filter out irrelevant results. We could also limit by age group if we had not already included that as one of our concepts. In Ovid, limits can be found beneath the database's search history. Here, you'll find a small set of the most commonly used limits. Clicking Additional Limits will take you to the full list. By default, limits act on our most recent search line, but we can always choose a different line to apply the limit to. Scroll down to take a look at our limiting options. Useful limits may include language, publication types, and year published. To ensure our results are up to date, we could limit our results to articles published within the last 5 years. Once limits are selected, click Limit a Search to see your new results set. This creates a new search line, the results of which are automatically displayed. Scroll down and take a look. By default, the results are sorted by publication date, with the newest articles appearing first. You'll notice that our search terms are highlighted in yellow, allowing us to quickly identify why each result has been returned. We can also save our results. Each record has a checkbox in the upper left corner, which, when selected, can be used to either print, email, or export citations to a reference management software. Alternatively, you can select the All checkbox to print, email, or export all search results at once. This result looks promising. We can click the Get It button to check full text availability through McMaster's libraries. Your browser's pop-up blocker may prevent the Get It page from opening. If so, follow the link provided to see the options for online and print access. You can also view the citations for an article by selecting Cite. Ovid produces a citation for the selected article in AMA, APA, and MLA citation styles. Select Copy to copy the citation to your clipboard. However, you should always double-check any citations that are generated by Ovid, as they are not always correct. Once you're satisfied with your search strategy, you can also save it for future use. To do so, scroll to the bottom of your search history and select Save All near the lower left-hand side. A window will appear prompting you to give your search a name. Choose a unique and descriptive name, then select Save. If you're not currently logged into an Ovid personal account, the system will ask you to either log in or create a new account before your search can be saved. Creating an account is free, and it allows you to save multiple searches and easily return to them later on. You can also share your search history with others. To do so, select the Share Search History button on the bottom right-hand side of your search history. You have several options for sharing. You can email the search history directly to someone, copy a shareable link to your clipboard, or copy the full search history details, which you can paste into an email or document. You've now completed the Ovid Medline search tutorial. If you have any further questions about this database, please contact the Health Sciences Library Information Desk at extension 22327 or send us an email at hslib@mcmaster.ca. Thanks for watching.